Good morning. My name is Angela Baker, and I wanted to thank the District Board for this opportunity to discuss an important quality issue here at Valverde Regional Medical Center, and that's emergency department wait times. Today, we're going to talk about the current issue of the wait times at Valverde Regional Medical Center in the emergency department. We're going to look at those wait times with the emergency department and fast track included, and then we're going to look at how those visits go ahead and break down. We're going to look at patient satisfaction scores based on wait time in the emergency department. We're also going to look at data trends of data from April 2011 and how we compare with other hospitals across the country. Next, we're going to examine solutions to our quality issue, and we're going to look at the best solution and look at the action plan for that. Our current quality situation presents that since 2010, we've had an increase of 18% of volume of patients in the emergency department. We have one physician primarily operating in the emergency department and a mid-level provider, that would be a physician assistant or nurse practitioner, treating patients in our fast track. Jan, the regional M-Care consultant, came and examined our organization and stated that when patient volume reaches 22,000, that you should increase your mid-level provider by at least one. And we've been operating right now with one at 26,000 volume per year, so we have been operating over that volume. So, for a quality of care issue, we're looking at waiting times. So from door to fast track, our current waiting time is 118 minutes, with the national average being about 60 minutes. Now in the emergency department, from door to doctor, we are currently operating at 65 minutes, with the national average being 30 minutes. From door to triage, that's when a patient walks through our emergency department and is seen by the triage nurse. We're actually operating at 4 minutes with a national average of 3. So we're doing very well in that area. However, this is where our area of opportunity is, from door to provider in fast track in the emergency department. This is data from April 2011, and we're looking at our overall visits and how they break down. As you can see, 60% of our patients were seen in the emergency department and 26% were seen in fast track. Our admissions were 151 out of 1460 patients, which puts us at about 6%, and the national average is about 8 to 12. Leave without being treated, that's when a patient is seen by the triage nurse, and then when a provider is able to see them, they have already left our waiting room. Now that's about 3%, so that's an area that we want to address because we don't want patients leaving without being seen. And the other areas on this pie chart are leaving against medical advice, and that's 1%. Our transfers outside the facility are 1%, and our return within 72 hours, is 3%. Now it's important to note in that return to 72 hours to the emergency department, some of our patients don't have primary care physicians or any local doctors, so we ask them to return to the emergency department. Now this would be patients that need a wound check, wound change, or someone that we need to follow up on. So we've asked them to return within the 72-hour period. Next, we're going to look at patient satisfaction scores based on wait times in our emergency department. Now this axis has our percent of satisfaction scores, so the highest percent being 100, as you can see, and then our wait time based on hours. Our yellow line is our satisfaction scores for our admitting personnel. The red is nurses, and the blue is doctors or our mid-level providers. And today we're going to focus on the overall satisfaction scores of our patients in the emergency department, and that will be our black line. So as you can see, when a patient waits less than a half an hour, their satisfaction scores are very high. So they're getting in, they're getting out, and they're being treated in a timely manner. Now the majority of these patients are fast-track patients. As you can see, the longer a patient waits, slowly their scores go down. And here you can see a drastic decrease, and this is at our 2 to 2.5 hour mark. So at this point, patients rate us very, very low on satisfaction. So this is an area that we want to focus on, as well as our overall trend downwards based on wait time. So if a patient waits longer in the emergency department, obviously their patient satisfaction scores are going to go down. So this is a patient quality issue that we need to draw attention to. Now this information here shows how we rank across the country. Now right here is our small Press Ganey data bank. Press Ganey is a survey that we use to get our patient satisfaction scores. Now, our average patient in the emergency department waits about 2 to 3 hours. So that puts us in the 23rd to 5th percentile. So obviously there's a great opportunity for improvement in this area, and we really want to increase our numbers. And our goal for the hospital is at least the 50th percentile. So what I want to present to you today are 3 possible solutions to help improve patient wait times. The first is to continue our lean action plan. As you know, this action plan helps streamline patient process in the emergency department. And what it basically does is cut out all the fat of our processes in order to get our patient to see the provider in a timely manner. So we want to go ahead and increase those processes. However, those alone will not solve our issue, because in the end, it's getting a patient to see a provider. So as long as all the ancillary services in nursing are doing what they're supposed to, in the end, it's still the amount of time that it takes the patient to see the provider as our main concern. And when a provider is saturated above the volume that they can handle, those patients are going to wait. So another option besides our lean action plan is to continue to market our new weekend clinic. Now this clinic helps steer away volume from the emergency department. However though, we do have to realize the disadvantages of this clinic to our emergency department. And one that would be if a patient presents to the clinic that is high acuity or needs things that the clinic doesn't have, now we're going to have to look at increased complexity of care and transfers to our facility, which anytime you transfer a patient increases safety risk. An example would be if a patient presents to the clinic and they're going to need a CT, MRI, or special labs, or if they're acute enough where they're going to be admitted. Now all of these things are cases that increase the complexity and patient safety risk. So although the clinic is great for who it's designed for, low risk, low acuity patients, it can cause problems for our emergency room department in some areas. So the third and final solution that I urge your support on today is to increase our mid-level provider from 1 to 2 in our emergency department. This will provide another provider that patients will be able to see in a timely manner. It will decrease the burden and the stress that the providers have on them right now dealing with the current volume. It'll increase employee satisfaction. Now one disadvantage that you may think of may be an expense. However, if we have increased volume, that means increased revenue. And if we have an extra provider available to capture those patients and see them before they're leaving, then we're going to capture that revenue as well. And we have to think about the long term, how it improves our public image. So that's the best solution that I urge your support on today, is increasing a mid-level provider in the emergency department. Overall, it has great advantages for our patient care and our quality issue of wait times. And in the long run, it's going to improve our patient satisfaction scores, increase revenue, and improve our public image. So in summary today, I covered our emergency room visits, our data from those, how we trend based on time, and our trend downward at the 2 to 2.5 hour mark. And then we looked at how we compare with other hospitals across the country. I presented the best solution to this situation and our quality issue of wait times in the emergency department, and that is to increase our mid-level provider from 1 to 2 providers. Again, I urge your support of this in a timely manner as it is an important issue to our patient care processes. At this time, I would like to answer any questions that you may have, and once again, thank you for this opportunity for speaking with you on this important quality issue here at Val Verde Regional Medical Center. Thank you.